We're here at the Golden Jubilee Hospital in Clydebank launching the new NHS recovery plan. The NHS has been under significant pressure because of COVID. It is still under significant pressure. There's a big backlog of care and treatment that we need to tackle and also put the NHS on a sustainable path for the future. So this recovery plan sets out how we will invest an additional £1 billion and how we will build NHS capacity across primary care, diagnostics, outpatients, inpatients by 10% in order to see more patients, but also how we will innovate and reform how patients come through the NHS, which is more efficient but crucially also delivers better patient outcomes. This is a massive national undertaking that will be a big priority now and over the years to come.
And when can we expect the NHS to be back to pre-pandemic levels?
Well, we set out in the plan over the next few years, year on year, the additional capacity we expect to see. We're going to continue to see a COVID impact in our health service for a period yet to come. We're not out of COVID yet, but there's also an unmet demand of patients who, because people were being told to stay at home because of concerns about being exposed to COVID, patients haven't perhaps come forward to be diagnosed. So we will see a rise in demand from COVID for a period to come. This plan sets out how we will deal with that, increased capacity, but also innovation in how we treat patients. Getting primary care, GP services back to more of a face-to-face consultation model, while not losing the technological advances introduced during the pandemic, is a big priority of this.
And how will this help health boards right now? I mean, Greater Glasgow and Clyde, they have asked people not to come to their A&E service unless it is life-threatening. How will this be able to change the situation they're facing now?
Well, this plan in all of its parts will have impacts, positive impacts for health boards straight away, but I don't want to lose sight of the fact that much of the pressure on our NHS today is still being exacerbated by the ongoing COVID situation. So we've all got a part to play in that. COVID cases are rising at the moment. I would expect to see them take another rise today, and we can all play our part in slowing down that transmission. So it's basic things. It's wearing your face covering, washing your hands, keeping a safe distance from other people, staying outdoors as much as possible, ventilating rooms indoors. We need to all do all of that to make sure that we are helping reduce the COVID-related demand on our health service.
But we know that the Scottish Government has to balance its budget each year, so where will this money be coming from?
We'll set that out in our budgets, and we do that every single year. The Scottish Government can't overspend its budget beyond very strict limits, so this is extra money for the health service, and year on year we will set out exactly how that fits into our overall budget.